there's estimated that there are 275,000 undocumented immigrants living in the state of Maryland, roughly about 5% of our state population. And I don't know really the whether this is a reliable source, but there's an online company called KFF that reports that as of 2023, 50% of undocumented immigrant adults in Maryland reported being uninsured compared to less than 1 in 10 naturalized citizens and 8% of U.S. born adults. So, I mean, that's a big number, 50%. Currently, federal law prohibits undocumented residents from enrolling in federally funded coverage or to purchase coverage through the Affordable Care Act. But a few states, California being the exception, fully allow state-funded coverage to certain groups of low-income people, regardless of immigration. Cary, we would all like to have universal health care for people and have them get the care they need. But the proposal for Maryland to allow undocumented aliens to purchase health care on the private exchange comes at a cost. What do you think?
Well, I mean, you got to think about it. If 300,000 people, and I'm going on Bonnie Colson, Delegate Bonnie Colson's numbers, if 300,000 people in Maryland don't have health insurance and 100,000 of those are undocumented, you got to realize that our emergency rooms is the last resort for health care for people who don't have insurance. And if you think that we're not paying for that, you'd be wrong. Our insurance premiums go up when hospitals can't collect, fees for their services. Insurance fees go up. You get stipends or money from the state to help these hospitals because they're not going to take the hit. So I'm all in support of providing opportunities, insurance opportunities for undocumented Marylanders. They're purchasing it. If we can collect some money, it's better than not collecting any money.
Well, I mean, Cary, you make a very good point. But Laurie, when the Department of Health briefed the General Assembly, it said that it could cost even $1 billion in funding subsidies. We have a huge budget deficit right now. Nobody wants to pay higher taxes. How do we balance that? How can the state afford that?
Well, we can't, and they're giving us snake oil right now because Bonnie Cullison is putting forth, she's a delegate, putting forth a bill called the Access to Care Act, which is it's not going to take effect until any time later that they choose. But they're making it sound like it's happening right now, and it's going to help a lot of people. And it's just trying to buy votes for the 2024 election. So this is selling its snake oil. That's what I thought we were going to see with the Westmore administration. I have another idea. It's called the DEPORT Act. Let's try that acronym and see. And I don't want to sound awful about it. It is cruel that we don't want to hurt people, but they have come here illegally, and we need to have a plan of deporting people who are breaking the law. For one thing, if they're, we've just seen some recent incidences where Montgomery County has ignored ICE rules and it hurts American citizens. There are now citizens getting hurt by people who are committing crimes who cross the border illegally. We've got to get a handle on this and deport some of these people, and that will reduce the cost to Marylanders, and that is a fact.
Well, I mean, we wrapped up a whole lot of topics into that one answer, Laurie. I'm not sure how this is going to play out. This same bill was brought up last year, and it did not pass. The rumors are that it's not going to pass this year because it's too expensive. So we'll just have to wait and see. When we come back from this short break, retirement is in the air as Chief Jones and Representative Ruppersberger announce their retirement plans. Stay tuned.